been really lucky to have been involved in 4 Olympic Games so far, and including the Rio Games coming up. I was a registrar in Sydney, and I was lucky enough to be involved in the volunteer program there, where I was working in the polyclinic, and I also was one of the doctors at the track, in the track and field, so I was really lucky there. I went to Athens and Beijing with the Australian women's basketball team, and then obviously in Rio this time around. So didn't go to London, but that was because we had our youngest child at that time. Sports medicine, like a lot of other things, has evolved over the last 20 years, and I really think that the Sydney Olympics set a real benchmark for the delivery of athlete care services, and part of the message that we provided a great Olympics in Sydney was the sports medicine care that was delivered during those games, and people like Ken Crichton, who was the Director of Athlete Services at that time, really set an amazing standard. At the Rio Olympics, I'm actually going to be working in the Australian headquarters and medical centre, and we set up every Olympics these days in the Australian team. Half of a floor is actually dedicated to medicine and the delivery of that to the Australian athletes and officials. We're going to have at least 30 staff in medical headquarters, and that includes doctors, physiotherapists, massage therapy, and other services such as psychology that would may be required in the 2 weeks during the games, and also for the week or so as the athletes are arriving. So quite a good number in the centre. The polyclinic is used by the Australian medical headquarters to help provide all the imaging that we would require for diagnosing and staging injuries. But it's also an important backup for us, in emergency situations where someone has actually been injured sufficiently that would require that emergency service. Medical imaging has a great role for helping us guide the athlete back into play and competition if they're going to be fit to do that. So in a game situation, we're under a lot of pressure to have that athlete ready, and the athlete also needs to know that they're ready as well. And having that imaging can help reassure them that they're actually going to be okay, and it also helps us to guide us about coming back into play safely. So for instance, an ankle injury, if it's fairly low grade, then we know that typically would be a week or 2 in terms of having them right. So in a game situation, obviously things are fairly compressed, and we'll be doing a lot of treatments to accelerate that process, but we may even use a second image to see that swelling has settled down, that there's nothing else holding them back, and it also gives the athlete a lot of confidence to go back into play. I, like a lot of sports physicians, actually use ultrasound for more the injection side of things. It helps my diagnosis and clinical assessment of the athlete, and anyone else I might be seeing for that matter. But it's actually a really important thing for patients to also see their injury. So we use it as a two-way thing. It's not just us making the diagnosis and helping to perform the injection under a guided situation, but also it really does help explain to the athlete how their injury is, how it looks to us, and helps them understand it a lot more. Yeah, the Games is a huge challenge for us medically. We're there for such a short period of time with a large group of athletes that largely don't know us and we don't know them. We obviously have a lot of background on the electronic system, but we really try and sort of get their confidence and get them to trust us is a really important thing. They come from lots of different parts of Australia. They're lots of different ages, so we really have to try and get a rapport really quickly with those athletes, and so there's a lot going on in their heads during an Olympics. There's the psychology of just being in a different part of the world, totally different time zone, lots of different cultural issues that they're facing, plus all the pressure of competition and everything else that's sort of going on. So psychology comes into it as well. An electronic record is a fantastic resource that we utilise a lot in Australia. We have a system that's been in place before the London Olympics, and it's so much easier to find information on athletes that you may not really know all that well. And so in a game situation where, for instance, we have over 700 athletes and officials, having an electronic system that can rapidly give us information on things like allergies, past medications that they've been on, past treatments, injuries, illnesses, that sort of thing, we can pull up really quickly. It's fantastic. So, you know, the games in the 60s and 70s and 80s really didn't have those services that we provide now. So the great polyclinics with all the things that, you know, like the imaging services and the pharmacy and everything else that sort of comes with it, the electronic records, all are built on the shoulders of those previous Olympics, and it's just such a proud thing to be involved in.